Good day. Hi, everyone, and welcome to another episode of Fertility Talk. Today, we are talking to Professor Siebert, and he is from Aevitas Fertility Clinic. So, thank you very much, Professor, for joining us today.
Thank you, Leanne. Always nice, and thank you for the invitation. And hi from a sunny Cape Town, and
Yes.
to all our listeners. Thank you.
Thank you very much, Professor. So, Professor is a fertility specialist at Aevitas Fertility Clinic, and I was just reading something about you, and you are you have a special interest in PCOS, and furthermore, you've also recognized for your expertise as an endometriosis specialist and a gynecological endoscopic surgeon. That's correct, eh?
That's correct. Thank you, Leanne.
Okay.
Thank you for the introduction.
Thank,
Yeah.
thank you very much. Okay, so we're going to start off with our first question. Like I said, I mentioned we are talking about fertility preservation. And I think more and more women are doing this because of the way our life is very busy and they want to be with they're doing their studies and that type of thing. So family planning is happening a bit late in life. That's why I decided let's do a talk on fertility preservation. So our first question is, what are the main reasons someone might consider fertility preservation and who is a good candidate?
Yeah, so let's just pause 1 minute. So, what's the definition of fertility preservation? Is that you want to use your eggs. We can't preserve your ovaries. We
Mm,
can't stop the clock, but we want to preserve some of the eggs for future use.
mm,
So, the problem with a woman, where the difference is between male and female, Leanne, is that we as men started to produce sperm when we were about 13 years of age, and we continuously replenish all our sperm stores. Every 78 days, we replenish all the sperm stores till the day we die. That's why people can have children when they're 70 and 80, men.
yeah.
On the other hand, a woman is born with all her eggs, every single egg at birth. And since from the point of birth, you lose eggs.
Mm,
So, just to give you a simple example, if you start to menstruate at 10 and you go into the menopause at 50, you have 40 years of menstruation. You ovulate one egg in a month. There's 12 months in a year. 40 times 12 is 480 eggs. You are born with 1 to 2 million eggs.
mm,
And when you go into the menopause at 50, all the eggs are gone. So what happens? So it's a natural depletion of your ovarian stores. And that's why if there is a scenario that we can't use the current eggs, or there's an incident like chemotherapy, cancer treatment, surgery to the ovaries, endometriosis surgery, or a delay of my first child older than 35 and
mm.
my egg stores become depleted. Those are really the main reasons why we then freeze the eggs so that when we use them when we're older, the age of the egg predicts the outcome. So when I'm 30 and I freeze my eggs and I use them when I'm 40, that egg, that 30-year-old, is the pregnancy rate for the 40-year-old woman.
Mm.
And that's the reason we preserve the eggs.
Thank you very much, Professor. Our next question is, what are the different fertility preservation methods available for both men and women, and how do they work?
All right. So for men, that it's simple in the post-pubertal man. So when he starts to ejaculate, we freeze his sperm. He ejaculates and we freeze the sperm. In the prepubertal male, when they haven't have yet the mature sperm, we
Mm,
need to do a testis biopsy. Now, that is still in research, Leanne,
mm,
whether we can in future mature those sperm, which is still
mm,
immature, frozen, and in future mature them in the laboratory to be able to use. I would rather do that than to do nothing. We see so many young men that had either radiotherapy to the testes or surgery, and they haven't preserved their sperm. So in the prepubertal male, we do a biopsy. Post-pubertal, it is very simple, and it's an ejaculate. In female freezing, if you are post-pubertal and you are already ovulating, we stimulate you, like in women with IVF, to make many eggs. We harvest the eggs and we freeze. If you are prepubertal, same principle as the male, and you prepubertal and you haven't started to ovulate, we can also do freezing of the ovarian tissue. So we take a part of the ovary, we make slices, we cryopreserve those slices, and when later on in life, we can then implant those slices of ovarian tissue into the leftover ovary.
Wow. It's like medicine has advanced so much. This is something I obviously haven't heard before, but that's amazing. Thank you for that. How does the process of egg or sperm freezing work, and what is a typical success rate of future conception?
Yeah, so let's start again with the male. So the current freezing we use is cryopreservation. It's a very rapid preservation. So older days we use slow freezing. It's like literally putting it into your fridge, and over a period of time it's frozen. But there's a lot of time, or a time period, that either the sperm or the egg can get harmed in that long phase, the slow freezing. So today it's rapid. We use a cryopreservation. Okay. So that's from a sperm point of view. We use cryopreservation. Success rate, very good. Because if you think a normal male semen analysis is 15 million sperm and more in every milliliter. So even if you lose 5 million sperm, you still have 10 million left. So sperm freezing is a simple, very successful procedure. Egg freezing, on the other hand, is a bit more tricky, because we can perhaps harvest 15 or 20 eggs. So if you lose 10 eggs, you've got only half left to work with.
Yeah.
And if you work with a young woman, you need about 15 eggs to give you a 95% chance of pregnancy. So people think, oh, I've got one egg, I've got a chance of pregnancy. Yes, you have, but realistically, you need about 15. So in female egg preserving, you go through a stimulation. We harvest the eggs, again, cryopreservation, which is a rapid freezing. And today, our success rates are really very close to that of embryo freezing. So historically, the embryo freezing results was much better than the egg freezing. But with the new freezing kits and the newer technology, it is as good as freezing an embryo.
Wow. Thank you very much, Professor. At what age should individuals consider fertility preservation, and how does age impact success rates?
All right. So again, just start with the male. So we don't really, there's a small drop in fertility after about 45 in the male. But, we still can have children when we're older. We all know the old story of Pete Korenhoff, who had a child at 76. So we can still have a child when we are old. But with male, definitely you've got to freeze your sperm before any radiotherapy or chemotherapy of the testes. It's very, very important. So that's the important part. Age, not a big issue. In female, we really want to freeze the eggs before they're 35. Because as you get older than 35, there's quite a drop in your fertility potential. So yes, even if you're 38, we can freeze eggs, but the success rate is much less. but it's much better than nothing.
Mm.
So then that's very important to discuss with your fertility specialist. What is the success rate at this age? So if you do it too young, on the other hand, Leanne, and we think, and we all get now very anxious and say, oh, when I'm 20, I've got to freeze my eggs.
Yeah.
There was a very good study done in Australia, and they did just random freezing of eggs, just when it started, the fertility preservation. And less than 3% of the women use their eggs. Because when you're younger, 20, you're not going to freeze your eggs because most probably you'll meet your Mr. Right and you'll have your pregnancy. But when you get to about 30, 31, 32, you really need to consider if you haven't met Mr. Right or if there's any endometrioma surgery. So that is a very important point. Or whether there's any cancer treatment, then we definitely need to look at it. But social preservation, none of these events only age, I would say, really definitely younger than 35, ideally 32, 33.
Thank you very much, Professor. Our next question is, are there any health risks or side effects associated with fertility preservation procedures?
Okay. So sperm, no.
Mm.
Yes, in young boys, I had a patient, a young guy who never masturbated, and we had to discuss with him to masturbate. So there is an emotional impact. In female, you've got to get, if we do the egg freezing, you get stimulated like a woman with IVF. So historically, there was a risk of ovarian hyperstimulation. So ovarian hyperstimulation is a syndrome which will present itself when you have too many eggs. Those eggs produce estrogen, and the estrogen makes your vasculature, all your blood vessels, it increases the permeability, and that can make you very sick. Today, we've got a trigger shock. So the last trigger to mature the eggs that will prevent that hyperstimulation trigger. So yes, there's a risk, but it's a minimal risk, less than 1%, if you are triggered by the correct medication. If you do ovarian cortex freezing, that we use the strips, it's unfortunately a laparoscopy in the young female, in the young girls. It's a laparoscopy where we then remove a part of the ovary and do the slices. So yeah, I think it's all then, the risk is then the surgical risk, but with the stimulation, it's minimal. And we rarely see today the ovarian hyperstimulation.
Thank you very much. We almost through it all. And then the next one is, how do lifestyle factors such as diet and overall health affect the quality of preserved eggs, sperm, or embryo?
Okay, so what are the factors, but you're actually asking, that impacts on egg and sperm quality? So we know today that there are a couple of lifestyle issues. So weight, smoking, alcohol, too much coffee, those are all factors that can have a negative impact. But while they are preserved, nothing is going to have an impact on those. But it's really then at the point of when we do the preservation, how healthy am I? And that's really then important to look at these factors. A very interesting point on smoking. It's the one factor from a social point of view that has got a negative impact on your ovarian reserve. So the average woman that smokes loses about 3 to 4 years of her ovarian reserve. So smoking has got a definite negative impact on the egg quality and the ovarian reserve.
Thank you very much, Professor. Our very last question is, what are the latest advancements in fertility preservation technology, and how might they improve outcomes? So you actually touched on that earlier when I said to
Yes.
people like, wow, but please enlighten us on that one.
So again, so firstly, the procedure is the cryopreservation. So where it was historically the slow freezing, and over a period of hours, that gamete, the sperm or the egg, was frozen. And that obviously gives you a lot of time to harm the egg or the sperm. And with the cryopreservation and the new kits, we don't have that risk of there's still a risk, about a 10% chance that you lose an egg. But that is really the latest advancements is the new egg and sperm freezing methods.
Okay, thank you very much for that, Professor. We really appreciate your time as always. I know you're very busy, and but thank you for that. If anyone is interested in fertility preservation, can they contact you at Aevitas? What is the procedure for this?
Yes, I think there's a national drive from SASREC
Mm.
that we really want young women to preserve their fertility in the early 30s if they haven't met Mr. Right, or pre-cancer, going before they go through cancer therapy. So
Yeah.
really they go to the SASREC website, they look at the accredited clinics close to you.
Yes.
If you want to come to us, we are at Pinelands, Aevitas Fertility Clinic. But the SASREC website gives all the accredited clinics, and anybody close to you, one of those clinics should be able to help you.
Thank you very much, Professor. Thank you everyone for joining us, and we'll say thank you to Professor. Like I say, Professors at Aevitas Fertility Clinic. They are out in Pinelands in Cape Town. If you want to get hold of any of them, you're all welcome to visit their website, Aevitas Fertility Clinic, I think, .co.za. And you can also find them on our website as well, or you can find them on Instagram, Facebook, as well as just Googling Aevitas Fertility. So thank you very much for your time, Professor, and thanks everyone. Thanks. Bye.
Thank you, Leanne.
Pleasure.
Enjoy
Bye.
the
You do.
afternoon. Bye
Bye.
bye.